is big enough, at last, it's very easy to metastatic to the bone, to the liver, and to the lung. For colon cancer, actually, it's very common. Go to the liver. For the rectum, also for the liver, for the lung. For the breast cancer, it's very easy. It's very common to bone, to liver, to lung, and to brain, and so on. For prostate, it's bone actually is very common site for metastasis. For ovary carcinoma, for liver, for lung, and for some stomach, it's very common for our country. It's very common for liver, and for pancreas, also very common for liver, and so on. Here we talk something about the cancer prevention. Actually, according to the records of the tumor treatment, actually 1/3 patients are preventable. That means if we have much more healthy lifestyle, actually 1/3 patients we can prevent. Also, once some patients actually even suffer with the tumor, suffer with the cancer, this kind of tumor also can curable. So this kind of patients also we can do much better for this kind of patient. Of course, if the tumor goes very big, it's a very late case. Also, we can prolong their life and also can decrease their pain. So we can actually until now we have three grades of the prevention for cancer prevention. The grade 1 actually it's etiology prevention. So we find out some very accurate the etiology factor. For example, now we can go through for vaccine, just like a hepatitis B vaccine can prevent how to prevent HCC or hepatic cellular carcinoma. Also, we can how to go through the some vaccine, just like HPV vaccine. We can prevent women's cervical carcinoma. So this we call the grade 1 cancer prevention. Also for grade 2, actually how to early detect, how to early diagnose, and how to early treatment if the patient suffer with the cancer. It's also very important, especially for doctor, for surgeon, for physician, and so on. Also, if the patient, is a very late case, so we can also do a lot of things for patients. We can improve this kind of patient's life quality. So here, just show us some factor some factor can for cancer prevention. For example, we can prevent tobacco related cancer. This means just if we do not smoke cigarettes, a lot of some kind of tumor, for example, for lung cancer, actually will decrease a lot. Also, we can go through that and chemo prevention some agents. For example, for fat, actually it's related with breast cancer, colon cancer, and prostate cancer, and so on. So if we just to exercise more and we actually so we can prevent this kind of tumor. Also for some diets, much more fiber. For example, we have much more vegetable. If we have much more vegetable, actually it's better for our health life. Also can prevent some kind of tumor. Some reagents, just like retinoids and carotenoids, and also some micronutrients, also actually is important. Sometimes also can prevent some kind of tumor. Some medicine, just like aspirin and other non-steroidal anti-inflammatory drugs, actually also relationship with some cancer risk. Of course, if we just do much more for physical activity and how to decrease the body weight, and also it's helpful for cancer prevention. Of course, if we know some kind of patients, if is very easy, very common for some kind of tumor. Also, we can go through surgery to prevent some kind of tumor. Of course, now some concept like the immunological prevention also help patient a lot. Here we mentioned something about the cancer screening. We know some cancer, just like breast cancer, some gastric cancer, some colon cancer, is very common for some kind of population. So if we can do much better, we can screen something, and can very early find out some kind of tumor. So here is mentioned what's the cancer screening. Also, how to evaluate of screening test. So just for example, for breast cancer screening, also for cervical cancer screening, for some skin cancer screening, also for some colorectal cancer screening, and so on. Cancer actually it's most cancer is come from somatic mutation, for some gene. Of course, some cancer just relation with some just like not for somatic cell, it's for germline cell. So here the mention is cancer genetics. Actually, the cancer is a genetic disease. Somebody called like that. Mechanism of cancer because the mechanism of the cancer predisposition actually is very complicated. Now we showed us something just like the clinical characteristic of the cancer families. For example, some APC gene if mutated, actually some kind of family actually just suffer lots. The family member just actually just will suffer a lot from the colon cancer and so on. Also here the multi-system genetic syndrome. For example, just like talked to you before, just like the FAP, the HNPCC, and also so on. It's actually some syndrome for the family cancer. Also, we can see some non-syndrome hereditary cancer. Now we talk something on what's for the many manifestation for cancer. Here, we just mentioned about the 7 warning signals. One, actually the change in bowel or breath habits. For example, for commonly for everybody. For everyone, actually 1 time for every day, but now change it to 2 times or 3 times. And also for sore that does not heal, also unusual bleeding or discharge, it's not a very good thing, not very good phenomenon. Also for some thickening or lump in breast or for some elsewhere. Also, for indigestion or difficult in swallow. Also some phenomena such like obvious change in swallow or in the mouth. Also nagging cough or hoarseness. So this 7 warning signal, if it came out, so you have to very cautious to see your doctor. For the local manifestation of cancer, actually is not very common. It's not very complicated. First one, actually, most cancer actually showed us for the mass. Also, if the mass is very bigger, the patient will feel pain. If we know a mass is very bigger, if we know at last will develop also oscillation. Some patient, if we know some vessel, damaged at last or bleeding. Of course, sometimes, if the tumor just locates the gastric colon or something like that, actually obstruction come out. Of course, if tumor metastatic to the other side, and the patient can come out some metastatic manifestation. This slide show you, some local manifestation. For example, liver tumor. Also, this patient is a very big liver mass. Also, what skin, some lesion here. Also, it's if we use the endoscope, the colonoscope, we can see, for the fibers here. Also, if liver tumor, in the liver, we can, dissect, we can see a lot of, it's a big tumor here. Also, we can see some other, for the lesion here, also, this is also in the tongue. So actually, the tongue, just divided two parts of, it's actually is very painful for patients, Also, here, it's a hemangioma, for liver. It's of course it's a normal normal gallbladder. The tumor is too big, so actually for the central part, it's not necrosis. Also, this is a very big tumor in the leg. So actually, the patient he actually it's very difficult to walk. So after dissection, it's a very, very big tumor. Actually, it's more than 10 kilogram. Of course, tumor F is a big. It's for later case. Of course, actually a lot of systemic manifestation will come out. Actually, most of the systemic manifestation as non-specific. For example, for anemia or long fever, and also for the weight loss, and also some in here. Also, after the very, very little case, the patient will anorexia and cachexia will come out. This is some slides just show us, what's for the patient, some very specific signal, specific sign. So, after we have some very detailed history, also we go through for the physical examination, also for some lab examination, and also for the imaging examination. At last, we can diagnosis for patients. This slide shows us how to do for physical examination. One thing, for inspect, for example, we can how to examine for the breast. We can see, for asymmetry, also for skin lesion, for skin changes, also for nipple changes. Also, we can touch, that's how to palpate patients. Also, for exam for the nipple. Also, how to examine for the axillary lymph node. Of course, a lot of very advanced technique can help us how to diagnose the patient. For example, for ultrasound, it's very useful for some kind of patient, for some kind of tumor. For example, for liver cancer, gallbladder cancer, also for spleen and for pancreas. Some retroperitoneal tumor, very big, for the ultrasound is very helpful. Also for the kidney, for adrenal gland, and also breast and thyroid, and also it's very, very, very helpful. Of course, in much advanced or much better method, we can use the imaging, compute the tomograph. We can call it CT scan. For liver cancer and gallbladder, for some pancreas, for the kidney in the adrenal gland, and also some other, even for some colon, for esophageal, and also for stomach, for lung cancer, also for some musculoskeletal system, also is very helpful. Same way, actually, for we can use mechanical resonance imaging. We can call it MRI. It's very helpful for some brain and spine, also for head and neck, breast, liver, and so on. Some other very advanced scale, imaging, just like functional and metabolic imaging. We can call it PET-CT. It's almost until now it's the top imaging technique. So can very early find out some lesion in the patient body. Also, we can use some interventional radiology, also for the radionucleotide imaging and so on. This is just use radio nucleotide imaging for patients. This is just an interventional method. We can actually, this is a patient for TSE. Also, we can use some endoscope. For example, for GI endoscope. For sigmoid and also colonoscope. Also, we can use laparoscope. Also, we can use ERCP or some small intestinal endoscope. Also, we can use some bronchoscope and so on. This show you something for endoscope for the colon, also for some advanced stage as the patient very late case, we can use the laparoscope, can diagnose it. Until now, actually, for pathology, most important for diagnosis some kind of tumor, for first level, it's very easy to do. Is a fine needle biopsy, so actually, fine needle biopsy indication, is one thing, we can just if the patient has suspicious abnormality, we can do some FNA. Also, we can distinguish some between cyst in the carcinoma. Actually, FNA we can use cytology. Also, we can do biopsy. Sometimes we can use ultrasound guided FNA. Much better we can do biopsy, it's much accurate, it's most important almost for every patient, because until now, actually, it's the standard, it's the golden standard for tumor diagnosis. Of course, indication for biopsy, actually, it's very simple, even, if the patient have physical examination of some lesion there, until now, we have two techniques, one for colloidal biopsy and also for open biopsy. This is some kind of biopsy method, Also, we have some lab examination, to help patient diagnosis. For example, for serological examination, for example, some enzyme, just like the AKP, LDH, commodity, and so on. Also, we can find out some glycoprotein, just like CA50, CA125, and CA199, some so on. Also, some hormone, just like HCG, insulin, and the gastrin, and so on, can help patient diagnosis. Also, we can use some immunological examination, just like CEA, AFP, and so on, to help patients to find out some kind of tumor. Also, FCM sometimes is helpful. Of course, if we know for molecular level, we can use gene diagnosis. Here to mention some gene diagnosis for chromosome level, also for DNA level, for some small mutations, just like KRAS, P53, and APC gene, and so on. So if we got insufficient information for diagnosis, so we can staging some patients. Now current staging system, actually we call the TNM system. T actually mentioned the tumor, how big, N actually is the regional lymph node metastasis. Of course, for M actually is the distant metastasis. So include T, N, M. So at last we just according to the different T and M, so we can staging patient as the early stage of the patient or in its advanced stage of the tumor. For example, after breast cancer, after the very early, as the tumor is very small, actually, as the stage 1, if the tumor go bigger, also